Welcome to Liposomal Academy. Today's topic will be liposomal vitamin C and targeting the correct cells with vitamin C. As usual, our legal disclaimer: none of the information provided in this presentation represents a therapeutic regimen for any disease or condition you might have. Please advise your health professional for the management of your personal disease or condition. To briefly remind the importance of vitamin C, we have to remember that it's very famous in supporting our immune system. It provides antioxidant protection, supports healthy joints and skin, improves blood flow, supports a healthy aging, and aids also in iron absorption. If we need to summarize the clinical benefits of vitamin C, it is very well known to protect from pulmonary infections. It has got cardioprotective and other effects on our cardiovascular system. Anti-inflammatory and antioxidative mechanisms are, of course, the most investigated effects of vitamin C. Antimicrobial properties, immune modulations are also broadly investigated with clinical papers. Autophagy and also anti-diabetic effects are very well known to be possessed by vitamin C. But to understand its antioxidant mechanism, we have to remember what oxidative stress is, or what is a radical oxidative species ROS. An oxidative species is usually an atom that is missing an electron. And unfortunately, nature doesn't like imbalances. So once any atom has lost an electron, it will start to search another electron to compensate this loss. And usually, ROSes are very well known to act very aggressive in the search of electrons. So we see that they will start to disturb their neighbors. So in any case that this neighbor is a cell, we will see that the ROS will start to obtain electrons from our cellular membrane. And unfortunately, this may lead to cellular death. But what is an antioxidant? An antioxidant is any atom or molecule which has got excess amounts of electrons and is voluntarily donating those to the ones which are missing, which has got a lost electron in a structure. So we can see that an antioxidant is a volunteer donor of electrons to free radicals, so that they stop to attack healthy atoms or stop to attack our healthy cells. We know that vitamin C deficiency results in an impaired immunity and makes us more vulnerable to infectious diseases. Treatment of an established infection but requires significantly higher amounts of vitamin C. The reason for that is that the leukocytes, our defensive cells, actively accumulate vitamin C in a value that is 50 to 100 folds higher than our blood. So it is believed that this accumulation of such high levels indicates the important function of these cells, particularly during an active infection. This is quite understandable because if we imagine this as a leukocyte which is under attack of oxidative stress, it will suffer excess destruction, and eventually this will lead to cellular death, meaning that we start to lose our defensive cells. In order to prevent such destruction from oxidative stress, we have to provide vitamin C. But this is a little bit problematic due to the peculiar bioavailability of vitamin C. In 1996, Lewine had presented a study that shows that increasing the amount of vitamin C does not necessarily mean that the amounts in the circulatory system are augmented as well. We can see that almost 250 milligrams or 500 milligrams of conventional vitamin C results quite in similar plasma levels, which are unfortunately not effective enough to combat infections, because we know that the beneficiary effects of vitamin C are seen once vitamin C has reached millimolar levels in our blood. Liposomal vitamin C provides an excellent solution to this problem, because we know from clinical trials that liposomal vitamin C is much superior than conventional forms. And when we calculate the concentration of 1000 milligrams of liposomal vitamin C, we witness a level of 3 millimolars of vitamin C, which, as a matter of fact, is the threshold value to show a benefit of supplementing vitamin C. So it is important to actively support our body with high levels of vitamin C in our circulatory system, which must reach millimolar levels. But providing vitamin C in a liposome has got also a significant importance due to the absorption route. We know that liposomes' preferred absorption route is via the lymphatic system. And all types of defensive cells are traveling in the system as well. So meaning that liposomal vitamin C delivers this valuable ingredient first to the lymph system, and those cells who need vitamin C almost 100 times more than the circulatory systems are provided first with vitamin C. It is of course very important to protect our defensive cells, particularly when we are vulnerable against infections or when we are already suffering from them. In 2019, Carita and her colleagues had proved that the antioxidant properties of liposomes are higher compared to conventional forms, meaning that liposomal encapsulation protects the antioxidant capacity of the active ingredient. But they also proved that cellular uptake of liposomes were 5-fold higher compared to uncoated drugs. These results suggested that liposomes are effectively uptaken by cells because we witness that the level of the active ingredients in the cell are higher once they are liposomal encapsulated. But at that point, we have to remember that appropriate liposomes should be in the correct size to be effectively uptaken by our defensive cells, because those are the cells who desire particularly vitamin C the most. They should be in a cationic nature so that they will be attracted by cellular membranes and increase the cellular uptake. But the most important aspect is they have to protect their liposomal integrity, meaning that they have to prove their stability under several pH conditions so that they can survive the harsh pH conditions of the gastrointestinal tract. Vitamin C and respiratory tract infections are a very popular topic, and patients with respiratory tract infections have, as a matter of fact, decreased vitamin C levels. So supplementing vitamin C levels are ameliorating the severity of the respiratory tract infection, meaning that they are helping to overcome the symptoms of the respiratory tract infections. Prophylactic vitamin C supplementation also appears to decrease the risk of more severe infections, but it is important to remember that all of these benefits can only be obtained when vitamin C levels are over millimolar levels in our blood. So the millimolar level is like a threshold level to give vitamin C the chance to show its benefits to protecting our body. The bottom line of today is vitamin C plays a key role in a lot of physiologic processes. But to benefit from its immune effects and immune support, the blood levels have to reach millimolar levels. We know that liposomal vitamin C can reach 3 millimolars, so that vitamin C can truly start to show its efficacy. Cellular uptake of appropriate liposomal vitamin C is 5 times higher compared to conventional forms. And at that point, we have to remember that our defensive cells are accumulating vitamin C 100-fold higher than our blood. So we see it is important to reach certain threshold levels in our blood, but it is also important to deliver vitamin C to our defensive cells. Please continue to follow us on Liposomal Academy on our YouTube channel and our Instagram account. I thank you for listening to this video and hope to meet you soon with other liposomal nutritionals. Have a nice and healthy day.